Good morning and welcome to the first ever live transmission of Health TV. Well, today I have with me the chairman of the Health Community Partnership CIC, Steve Pye, and Anthony Oswin, who's the managing director of Health TV Limited. Well, Steve, if I can start with you first of all, good morning and welcome on into what is a very special morning for us here. Can you explain to me who the Health Community Partnership CIC members are and how you became involved yourself in Health TV?
The Health Community Partnership CIC is a not-for-profit organisation which we set up with a couple of local businessmen, Mike Turner of Turner Accountants and Damien Broughton from Danbro Accountants, who's Damien Broughton, who's also MBE of Danbro Group, Chief Exec. We've put that together to illustrate and support the health sector's different concepts that they have and bring them all together. And what we did was to set this CIC up so that we can harness all the partnerships and bring all the groups together, because they're a bit spread out all over the place.
I was just going to say, how much needed then is this service, would you say?
I think it's very much needed. There doesn't seem to be a visual presence for the health sector anywhere. And with everything going online now, interactive, a visual experience is better than reading reams and reams of paper and print.
So much of that's a way to, of course, in the health service. It'd be nice just to switch the telly on and just have a catch-up, wouldn't it?
That's right, yeah.
Tony, if I can come to you first, secondly, why did you set up Health TV?
Well, they often say, Andy, that some of the best ideas are born out of those light bulb moments, or, you know, a substantial gap somewhere that people just simply realise doesn't happen. My son is about to graduate from a film and media course this year from a leading film school in the UK, and he's been involved in a lot of community groups and health-related projects and filming and so on. And coincidentally, I'd been involved in a variety of health-related organisations and groups on a consultancy basis. And it was just listening to the general comments and feedback from doctors, practitioners, administrators, the private sector as well as public bodies, that there was a gap in the market, because there's a lot of information out there and a lot of resources in the health industry, but they're not centralised in one place.
How do you get all that information and net it down into TV?
Well, this is the difficult part. We operated a series of focus groups and a series of consultative bodies, and taking a wide view of opinion from different sources. And continually I kept thinking, if you switch on your television or your digital box or internet channels or whatever, there's always something there for specialist interests, like the caravan community or food channels, cars, motorbikes, you name it.
Niche broadcasting.
Yes, absolutely. Yes. And it caters for all sorts of things, but there was nothing for health, no centralised health channel.
Were you surprised at that?
I was extremely surprised, because normally, if, for instance, as a private person, if you have an ailment or something, you want to check out, the traditional route is you phone the doctor and you wait about 3 weeks for an appointment, because of the strains that there are on the health service. The professionals are doing a marvellous job with, increasing pressure, and there's a drive from the government and from the various health authorities for self-care and self-monitoring and, sorting certain things out yourself that prevents extra strain on the health service. So we brought this all together with a variety of consultants, and it's been pretty hard going. I knew Steve through various other projects, and we've worked together quite intensely on this particular platform. And the one missing part was the platform itself. So through contacts, we went and found a leading web developer and platform developer, one of the best in the area.
Yes.
And he came up with that extra, that missing key, and that's how Health TV was born. And I think it's a very exciting project.
So what's going to be the next step now then?
Well, I don't want to give everything away, but, that's the traditional thing that people say if they're, they haven't mapped it out correctly. But the next step is that Health TV is going to be bringing fresh and innovative content, quality content to the channel. We're involving the public sector as well as the private sector. We'll be filming at exhibitions, conferences, a variety of events that are going to have an interest not just for professionals and practitioners but also for the general public as well.
And the key driver, of course, to attract sponsorship to help the project along.
Yes, it would be helpful to do that because we feel that there's a way of bringing targeted advertising and targeted promotions directly to the people that want to see that, rather than just a scattergun approach to advertising or promotions of products or new treatments, which is traditionally the way that the manufacturers and the producers have done that in the past. This is a very specific niche targeted market, and we think it's really going to have an impact on the nation's health.
Excellent. Well, we start Friday morning with a bit of paperwork. You have a memorandum of understanding.
Yes.
That defines your relationship.
Yes, just to define things and a roadmap, if you like, Andy, for moving forward. And I'm really proud and pleased that we've got to this point where I have in my hand a piece of paper, as the old expression said. But this is a worthwhile piece of paper, and I'm going to ask Steve on behalf of the Health Community Partnership if he would sign on behalf of that organisation with Health TV.
There we are, Steve. Sign away.
Thank you very much.
And whilst you're doing that, we'll take a short break and we'll be back in just a minute here on Health TV. Welcome to Health Community TV, the healthcare professionals channel. We'd like to introduce an innovative, dynamic platform that brings together the public and private healthcare sectors by producing a visual array of informative health-related topics. Through a unique partnership of leading healthcare and media companies, we're launching a free members-only TV channel for healthcare professionals. Well, they'll benefit from membership to Health Community TV because they'll be able to gain access to videos on demand and during live broadcasts to fit around their busy schedules. Health Community TV has been developed to promote health-related technologies, news, products and services to busy health sector professionals. They'll have secure membership access to powerful and informative content through live and recorded video broadcasts. Specialists can review healthcare products and services from video reviews and presentations, signposting patients to the ones that will help with remote monitoring and self-care. Our live broadcasting of health-related exhibitions, events, presentations and conferences will be funded by private healthcare sponsorship at no cost to the public purse. Healthcare events are usually held regionally, so some healthcare professionals can often miss out because of the distance they have to travel. But with support from event organisers, Health Community TV can overcome this challenge by broadcasting these health conferences, events and exhibitions live over the internet through our outside broadcasting unit. We also provide a recording of the live broadcasts and make them available online on demand so that no one will miss any of the key topics covered at the events. Health Community TV is a free-to-air, free-to-access platform for healthcare sector professionals. So please visit our website now and register today. And welcome back to Health TV. A very good morning to you. Well, I'm now joined by Liz Ashall-Payne, who's the founder and CEO of Orca. Liz, what is Orca? What does it mean to the health community?
Okay, so Orca stands for the Organisation for the Review of Care and Health Applications. And it's born out of the fact that there's currently 170,000 health and care apps out there. And every day we see 4 million downloads of these apps, which means that our citizens and consumers of their own health are downloading these products. And when asked, professionals and clinicians, 93% in fact, say that these products could really help with patient health outcomes and population health outcomes. So we have a real problem because it's not systematically being used within the NHS for the benefit of patients and populations.
It's amazing that these apps can actually help. I mean, I'm new to all this. I mean, you think to yourself, you take out your phone, you have a look at it, and you've got all your maps on the screen and that. But there's stuff that can help you with health.
Absolutely. And the problem is which one do you choose? There's 170,000. And when you go to the app stores, you type in something like diabetes, you might get 3 or 4, when actually there's 3,000 diabetes apps out there. So to try and support and solve that problem, what we do is we review the apps for you. And it's quite a detailed process that we go through. But in essence, the reason we review the apps is so that clinicians and professionals can feel confident to search, compare, and then recommend apps. People, like all of us, can then find the best solution for ourselves. And also, we want to promote the best apps to get the best results.
What are you looking for then in the ideal app? If you're going through all these reviews, which bits are you discarding, which are you keeping on?
Okay, so our review process is quite a lengthy process. So every week we do an automated data scrape which pulls in all 170,000 health and care apps. The first thing we do is we apply a did not qualify filter which gets rid of redundant apps. And the reason that's important is because if an app isn't updated or maintained, then it could be full of glitches and data security issues could be found. That gets rid of 90,000 apps. Then what we do is we curate them, so we work out what does the app do. And this is really important for being able to search for an app because an app name doesn't necessarily correlate with a condition. Once we've done that, we're then really looking at data safety and security. We're looking at clinical validity and academic robustness. We're looking at design and testing processes that the app's gone through. And we're also looking at user feedback.
That is quite a stringent requirement, isn't it? I mean, people all over the place making these apps, putting them on the market, and you're there making sure that they're passing all these stringent requirements. That's quite a big ask.
Well, absolutely, and there's currently 2,500 standards out there. And so it's a challenge for anybody who's developing a product to know about all of those standards. So what we found is that all the communities, clinicians, healthcare organisations, consumers and app developers really welcome this.
How will Health TV and the community partnership add value to your current offering then?
So what we do is we help people to find, compare, search and then recommend apps. And that's brilliant. But for an individual, either a clinician or a consumer or even an app developer who wants to know more about a product, where do they go to find out more? At the minute, Google is their friend. But what this offers is a really quick way to find more information about specific innovations in a really accessible way.
Well, we've actually got our own app on the way as well, Steve, haven't we?
Yes, we have indeed. So I hope that gets a favourable comment from yourself, Liz. Just the Health Community Partnership recognise companies like Liz who are at the cutting edge of the health sector with, helping them, supporting them and bringing out the right outcomes. And we're looking for these type of partnerships and these relationships and build on them over and over again to make this grow. And the Health TV, the Health Community Partnership, CIC, sort of support and companies like Liz's to get the messages out there to the people and a visual message as well that's very quick and accessible, on demand even.
Liz, is the Health TV app going to pass muster? That's the question.
We'll have a look.
Yeah, Steve, it'll have to pass plenty of tests.
No pressure there.
No pressure there
None
then
at all.
Now, you've got a memorandum to
have.
sign as well, haven't
Have
you, this
indeed.
morning? And whilst you're going to do that, I'm going to say thank you very much for joining us this morning. It's the first ever broadcast of Health TV. We do hope that you've enjoyed it very much. Please contact us if you have any contributions to make in terms of videos, news, or even if you have an event, conference or exhibition that you'd like us to broadcast. Thank you so much for coming in this morning.
you.
And to you, Steve.
Thank you very much, Andy.
And from us all here at Health TV, have a good morning.